Hello everyone, I am Sandra May Ibanyola from BSN 212E of Davao Doctors College. And today demonstration, I am going to perform a immediate newborn care. So prior to the conduct of the procedure, I have prepared the necessary equipments needed in order to save time and energy. So the equipments that I am going to use are the kidney basin, scissors, tuberculin syringe 0.1 ml, tape measure, disposable umbilical cord or cord clip, thermometer, lubricant for the thermometer, gauze pads, clean gloves, alcohol, 7% alcohol, mild soap, alternative eye ointment, alternative vitamin K, and cotton ball soaked in a alcohol solution, the diaper, the baby's clothes, and the draw sheet. So now let's identify the baby's name through her name tag or his name tag. And don't forget to provide adequate lighting for baby's comfort. Okay, so we have a baby girl who's named Liana Amitis. And let's turn on this light so that it will keep the environment warm. So after this, I am going to wake the baby, but before that, I am going to wash my hands first so that I can put on my sterile gloves. So now let's proceed to weighing the baby. Remember that we need to carefully hold the baby along with putting it in the weighing scale, for babies are considered fragile. So since there is an attached umbilical clamp to the umbilical cord, what I am going to do is to raise above the umbilical clamp so that it won't add to the baby's weight. Because usually umbilical clamp are used to help and stop the bleeding from the blood vessels in the umbilical cord. So let's just wait for until the baby's weight appears. Okay, so the baby's weight is 33.6 kilogram, which is in the normal range because the normal range is 2.5 to 3.7 kilogram. Okay, now we're done. Let's proceed to the cord dressing. So the first thing we need to do is the donning of sterile gloves, which we did already. Then in terms of properly restraining the baby, we need to do this fold method. Then now I'll be starting to disinfect the umbilical cord 3 times using a cotton ball soaked in a alcohol solution from the base to upwards. Now I'll be putting a sterile gauze pod under the umbilical cord. Then I'm going to clamp the cord using the clip cord or cord clip from 1 inch from the base. 1 inch from the base. 1 inch. 1 inch. 1 inch from the base. Okay, and then I'm going to get the scissor to cut the cord about 0.5 from the cord clip. 0.5 from the cord clip. Okay, then disregard the remaining umbilical cord. So after that, after disregarding the umbilical cord, we're going to wipe the excess blood from the umbilical using the gauze pod. Okay. And after that, I am going to place another gauze pod at the base of the cord. Then in terms of putting alcohol, we should try to put the alcohol in the gauze pod first, instead in the top of the umbilical cord, in order to avoid hyperthermia. Then you can now wipe. Okay? So now we're done with the cord dressing. Let's proceed to injecting the vitamin K. So injecting this vitamin K helps the blood to clot. So at this point, I am going to withdraw an exact amount of vitamin K from the ampule. So I'm be adjusting it to the middle third lateral aspect of the thigh of the baby. So here. And of course, don't forget to put the cap on before putting it on the receptacle. So we have our receptacle here. Okay, now so let's carefully get the anthropometric measurement of the baby, starting from the head circumference, chest, abdomen, and the baby's length. So first we need to measure the head. So carefully put the tape measure under the baby's head. So the baby's head is 52 centimeter. Then, let's proceed to the chest. Again, carefully put the tape measure under the baby's armpit. So the baby's armpit or chest area is 53 centimeter long. Then let's move on to the baby's abdomen. Okay, so the baby's abdomen is 62 centimeter long. So lastly, for the baby's length, we need to start from the head up to the feet. Okay, so the baby's length is 38 centimeter long. So after this, I am going to get the baby's temperature rectally. So before you put the thermometer in the rectum, we need to put a desired amount of lubricant for smoother access and for lesser pain for the baby. So we have our lubricant here. Okay, so let's just wait for a whole minute until the thermometer beeps. Okay, so the baby's temperature is 37.1 degrees Celsius and it is in the normal range. So now for the baby's initial bath, we'll be holding the baby in a football grip manner. Fold the ears like this. This is to prevent the water coming in. Okay. Use a mild soap or a baby soap. This is our alternative baby soap. So remember that when bathing the baby, you should be very careful because it's still sensitive. Pat dry the baby using the towel. Carefully pat dry the baby's head. So after this, we'll be putting on the baby's clothes. Okay. Okay, now since the baby is in the crib, I'll be doing the crates prophylaxis. Okay, so on doing this, we need to shade the newborn's eyes from the light and will open one eye at a time. We should remember that upon doing this, we need to exert gentle pressure from the upper and lower lid and apply the ointment from inner canthus to outer canthus. So in this procedure, you need to make sure that the tip of the ointment should not touch the eyes of the newborn. Okay? So now we'll proceed to taking the vital signs of the newborn, which means that I'll be only taking the heart rate and respiratory rate of the baby. So we'll start with the heartbeat. So now we're done taking the necessary procedures in immediate newborn care. So let's do an aftercare of all the equipment that we have used earlier. And of course, for the documentation purposes, the findings for future references will be the following. So here we have a baby girl named Liana Amity Santos with a weight of 3.6 kilogram. The temperature is 37.1 degrees Celsius, which is in the normal range. Then the head circumference is 52 centimeter, chest is 53 centimeter, abdomen with a 62 centimeter, and lastly, the baby's length is 38 centimeter long. So that's it. That's how we do the immediate newborn care.